Another edifying edition of your favorite health program, You're in Your Health. For presentation, I am Immaculate Fogwe. Breast cancer. The words alone can evoke fear and uncertainty in the hearts of many. But knowledge is power and awareness is key. In this special edition of the program, we'll take a closer look at the risks, the signs, and also latest treatment options for breast cancer. But before introducing our guest for the day, let's welcome my co-host, Lucy Liengu. Good day, Lucy. It's always a pleasure having the program.
Good day, Immaculate. Sure, it's always a pleasure. And good afternoon to all our listeners and viewers out there.
Thank you so much. And our guest today is a radiation oncologist at the Cameroon Oncology Center. He goes by the name Dr. MOSSE BA Wilfried. Good day, doctor. It's always a pleasure having you on the program.
Good afternoon, madam. Thank you for having me for
Good
this
afternoon,
program.
doctor.
Doctor, today we are looking at breast cancer, something that seems to be very common in Cameroon, and not just in Cameroon, but equally around the world. We want to ask from you, first of all, what's breast cancer all about, and how can you tell someone is suffering from this condition?
Well, breast cancer is that cancer arising in the breast tissue. A cancer is an abnormal division of cells that lead to be immortal, literally. They will destroy the tissue and they are able to go elsewhere in different organs and destroy those organs too. Well, around the world, breast cancer is one of the most diagnosed cancer. In Cameroon here, in women cancer, it's about 35% of all cancer. It's the first cancer in Cameroon for women, followed by cervical cancer. And actually, for symptoms, the symptoms are very common. It might be any change on the breast, starting from a lump, a sore, a wound, an ulceration, any change on the skin. It can be like we used to say peau d'orange. It can be a node in the armpit. So all those symptoms might alert any individual to go and consult either their general practitioner, their midwife, or the gynecologist.
What are some of the risk factors of developing breast cancer?
Well, being a lady is the first risk factor. Yes, men also have breast cancer, but in 1% of all cases.
Okay.
So being a lady is the first, followed by the age. The more we are aging, the more we are likely to have all the cancer, in fact, and breast cancer too. After all that, we have hereditary factors and genetic factors. I think they count about 5 to 10% of all cancer. For some reason, some person will develop some kind of genetic disorder. The most common and well-known is that gene called BRCA. There's two, type 1 and 2, but there's many genes too that are involved in cancer. Having a first-degree relative that have breast cancer, the risk might be multiplied by 2, 3.
Okay.
Yes, in the family, especially when this cancer comes when the patient is very young, let's say less than 40. Yes. After that, there is hormones that are involved. It might be intrinsic, like the patient or the person, let's say the person, was exposed to the hormone in a very long time period. Like the menses started very early, around 10, and the person goes to menopause very late too. That's the problem. Apart of that, you have those who are taking hormones pills. If you take it for too long, it might be a problem too. Aside that, you have environment factors, radiation, ultraviolet, and lifestyle too. If you are obese, you are not doing sport, you are eating, let me say it anyhow, no balanced diet, it can be a problem. Alcohol, tobacco. And there is one factor that is not also small. We talk about hormones factor, hereditary factors, age, environmental, lifestyle too. Yeah, those are the main, I think, but not that most of the time breast cancer himself, you will not find any risk factor.
Okay.
Yes.
And is it painful for those who suffer with this condition?
Usually at the beginning, it's not painful, but it can be painful. But since the disease is progressing, destroying tissue, pains will come always.
All right, before we continue, we'd like to give out the numbers. We already have them on our screen: 67054 7049, 67054 7049, or you can join us via 656-622222, 656-622222. You might be experiencing these symptoms and you love to ask your questions to the doctor. And back to you, Doc, we'd like to also find out, are there some specific factors, let's say types of breast cancer that do exist in our country, and which is more predominant?
Well, for us as clinicians, we classify the breast cancer exactly where it arises. In the breast tissue himself, we have what we call lobules and duct. So the cancer can arise from the lobule, we call it lobular carcinoma, and they might come also from the duct, we call it ductal carcinoma. There is a type also calling ductal carcinoma in situ. It's also a cancer known as a stage 0 cancer, but it's dangerous too, but it's something that will not spread. And we have breast inflammatory disease too. If you have this type of disease, inside there is subgroup. We will try to find out if that lady is already expressing.
We're back
Hello?
to you. Hello, good afternoon. Your name and where you're calling us from?
Je
Alors,
suis francophone.
sans problème, il faut poser votre question, madame.
Je voulais demander au docteur, est-ce que c'est vrai qu'il faut que les hommes sucent les seins des femmes pour empêcher le cancer du sein?
Ok. Il y a encore une question?
Vous avez...
Ok, merci. Merci beaucoup pour votre question. Doctor, you got the question.
Yes, can I go in French with?
Yes, you can.
Oh, ok. Il y avait ce risque que je n'avais pas dit, c'était le fait pour la femme de ne pas avoir accouché ou d'avoir accouché tard, après 30 ans, 35 ans, ou de ne pas avoir allaité. Ça, ce sont des risques facteurs de risque bien connus. Maintenant, ce qui est protecteur, c'est l'allaitement maternel. Les hommes peuvent bien sucer le sein, c'est une bonne chose, mais ce n'est pas ce qui a été décrit comme facteur protecteur. Ce qui est facteur protecteur, c'est l'allaitement maternel. Certains disent que le fait que l'homme aussi s'occupe de sa femme, voilà, et tout. Beaucoup ont découvert des...
We'll be back to you, Doctor. Hello. Okay, we lost the caller.
Yes. Beaucoup d'hommes ont découvert des nodules dans le sein de leur femme ainsi. Donc si on peut extrapoler pour dire que bon, ça peut être un moyen peut-être de dépistage, oui, mais ça n'a pas été décrit que c'est ça qui protège.
Now in English, I think.
Well, one of the risk factors is the fact that if the lady doesn't have any child or did not breastfeed during her life, it might be a problem too. So what we know as scientists is that breastfeeding is protector, is a factor that might protect from breast cancer, not the fact that the man will suck the breast.
Okay.
It's just like all of them are sucking, but it's not the same.
It's not the same.
Okay.
Yes. Because most time we have that confusion. They always say, and even when, especially in this month of October, they always say, laissez vos maris sous vos seins. They always say that.
We encourage it because some men will discover some abnormality on the breast too, so it's fine.
But the woman can discover by herself.
Sometimes when it's too small.
We have another call on the line.
Okay.
Hello.
We just lost
network. Yeah. Doctor, you are saying something.
Yes. So sometimes when it's too small and it's not paining, maybe you might not notice anything. Someone else can come and feel it.
So, Doc, I want you to clarify us on this. Laissez vos seins to say it has nothing to do when it comes to breast cancer, right?
Like
it will not play a role in preventing or preventing
preventing.
someone.
This is not something that we
Okay.
know as scientists.
Voila. This is an oncologist saying it clearly. So I don't want to get things again like that
It's
online.
breastfeeding.
Okay,
It's
breastfeeding. Babies. Okay.
All right. Okay, back to Dr. I don't know if you were already done because you're talking about the various types of breast cancer.
Well, I was talking about those subgroups. Now we'll check either the ladies are expressing hormones like estrogen, progesterone, and there is one factor calling epidermal growth factor that we are checking. So it may allow us now to put each patient on this kind of subgroup and to evaluate the risk of the disease. Some people who are overexpressing hormones, there is treatment for that. Those people who are overexpressing the epidermal growth factor also, there is treatment for that. Epidermal growth factor as hormones, they are acting like fertilizer. So those are things that we are evaluating to try now to classify the disease clinically.
All right, and doctor, according to reports that we have or recent data, it shows that lack of awareness, lack of screening or lack of awareness in our country has contributed to the high prevalence rate of breast cancer in the country. So now I would like to know how important is early detection when it comes to breast cancer?
Well, we not talk about it, but let me say, the disease start from stage 0 to stage 4. Stage 0, stage 1, those are disease where, in fact, the stage 0, for instance, we expect to have 100% of healing. Stage 1, maybe a little bit below, but always above 90%. And the treatment is very, let me say, cheaper than a stage 4 disease.
Okay.
When the patient reaches to a stage 4, it means that, first of all, it's not curable. And the patient will go into treatment, and those treatments are very, very expensive. So if a disease is, if there is a screening program that we can put in place, if we can detect the disease early, that is the best way to treat that disease at the very, very early stage. For some patients with a stage 1 disease, they might not need more than a surgery. Yes.
Okay. Are there any latest advancements when it comes to treatment of breast cancer?
Well, today we understand better the mechanism behind cancer cells development. So actually, researchers are working mostly on how to block all the mechanisms that those cancer cells are putting in place. Like, you know that in between cells and inside itself there is a communication to develop, to multiply themselves. So actually the drug that are produced are to call it checkpoint inhibitors. That blocks those cells from development. They are very, very specific. They will determine a point away and block it. Another one is that immunotherapy. For some reason, the cancer cells can hide themselves from the human immunity. Yes. So actually, they are developing drugs to either wake up the immunity, either reinforce it, so that your own body can fight those cancer cells. And also, there is novel hormone treatments that they are developing to be able to stop feeding those cancer cells.
And is there a possibility that breast cancer can impact fertility?
Breast cancer himself, like this, you can have your breast cancer and still have a pregnancy. But since you are going into treatment, some treatment might affect ovaries. Yes.
Okay.
All right. I also want us to look at the various roles played by screening campaigns, and I'm sure even at your hospital, at the Cameroon Oncology Center, there are some screening campaigns that are ongoing. How effective are these screening campaigns?
Well, people are coming randomly, but people are coming. For instance, for this month, it's every day and it's free for breast cancer, for cervical cancer, and for prostate. It's completely free.
Where is that? Can you tell us more? Where is this place?
Yes, Cameroon Oncology Center is situated at Bikoko after Bonaberi.
Okay.
Yes, Carrefour Palmaret. Over there, it's just in the quarter. It's not. It's well known. It's a well known place there. So arrive there. You can ask to anybody. They'll show you the center.
Okay.
Yes.
And now, how can women actually ensure that their lifestyle really suits to preventing breast cancer in our country?
I like this question. You know, if you look at the risk factors, you have those that you cannot do anything. If you have a hereditary genetics condition, you cannot do anything. But you can decide to avoid alcohol, to avoid smoking, to do sport, to avoid processing food. You can decide to preserve a good weight. You can decide, how can I say again, to have a balanced diet. You see, so those are things that, and also it's not only for breast cancer. There is some disease where there is vaccination, like cervical cancer, like hepatitis. So you can decide to
go for them.
Yes, to go for them.
Thank you so much, Dr. MOSSE BA, for your time on today's program.
Welcome.
Big thanks to you, Lucy, too.
Always a pleasure, Immaculate.
I equally want to thank all the technicians. We had Jonathan Babiola, we equally had Louis Pego, who ensured that everything was okay at the audio console. And from us to you over there, we say thank you for staying with us. Have a wonderful day in the company of interesting programs on Equinoxe Radio and, of course, television. Bye-bye for now.